I'm Dr. Frank Anthony, the Minister of Health, and this morning we'll be doing a quick update on where we are with the response to the COVID-19 pandemic in Guyana. As you know, one of our challenges has been working with improving the capacity at the National Public Health Reference Lab. We have increased testing, so we're testing more people coming in to our various facilities. We have sample collection in all the regions in Guyana, and because we have increased testing, we are now having a challenge with processing these samples at the National Public Health Reference Lab. We currently have a backlog of close to 1,000. That has been reduced from 1,900 a few days ago to now 1,000, but 1,000 is still quite a lot. So when we take a sample, it still takes a few days before we can actually get back the result. So we are working to decrease that time, and as an interim measure, what we have done, we have sent samples to CARFA. So last Monday, we sent 500 samples to CARFA, and we are expecting those results to come back either today or tomorrow. So once we get those results, I think we would have cleared a substantial part of our backlog. But one of the things that people would have to understand when we get back those results, because there are 500 samples that went out, and therefore you might see a big jump in the numbers, and I don't want people to be alarmed, because if we test X amount of samples, we are going to see positives in those samples. So when we get back the 500 results either this afternoon or tomorrow, you will see an increase in the cases, but this is because of the amount of samples that we would have tested.
Sir, you mentioned that because of the increased testing, that's why there's a backlog. A lot of people have been complaining about waiting more than 10 days for their results. Can you address that matter, please?
Well, again, the laboratory itself can only process so many samples per day. We were doing probably about 60 samples per day when I took over, and we have changed that. We are now doing between 250, sometimes 300 samples a day. We have moved from having one shift to now having 3 shifts. But even with all of these improvements, it is now still a challenge to cope. And the only way we can increase our capacity is that we'll have to get some new machines. We have, instead of having one line working 3 shifts, we probably have to get 3 lines working 3 shifts. And so that's what we are trying to put in place right now, to have more machines, more people working. We have done training, but to set up these machines and to build that capacity, it requires some time. We are working with biohazardous material. So these are live viruses that can infect people if they don't take the precautions. One of the precautions that we have to put in place in the lab, we have to get a biohazard cabinet so that when we are extracting the samples, it's done under these sterile conditions and conditions that the person who is doing the extraction is not affected. Now, to set up these cabinets, we can set them up, but they have to be properly certified so that we know for sure that no viral particle can escape and infect the staff of the laboratory. So these things take a little time to set up. We have put the mechanisms in place to do that. We have acquired the cabinets. We are in the process of installing it. And we have contacted the agencies abroad who would have to come to Guyana to do the certification. So a lot of the groundwork is done. But again, these things require some time before all of the processes, all of the equipment are properly in place and properly certified. But in the meantime, with the existing equipment, we have almost gone to the maximum threshold of how to use those equipment. So we're trying, and we understand the need to have a faster turnaround time, and that is why these interim measures like sending samples to CARFA are strategies we are employing in the interim. Hopefully, we'll get over this period very soon, and we'll be able to process faster.
And so you mentioned that the groundwork has been laid to expand the capacity, the testing capacity, but and you mentioned that somebody from overseas has to come in to certify these cabinets. Can you say what the timeline would be like for that? And
We're working on it. We have contacted the company. We are now working out the logistics of getting that person into Guyana. They have to be here physically to do all the checks. So we are now finalizing the logistics of that because, you know, with the restrictions that we have on flights, that can be a challenge. So once we have those parameters in place, then I'll be able to give you a more definitive timeline.
And in the meantime, we will continue sending samples to Trinidad to clear the backlog, or is this until we have completed clearing the 1,000 and then we'll just utilize our laboratory?
The challenge that we have, even as we today, we probably would collect maybe another 200, 300 samples from all the sites that are testing. So when we process 300, we are getting back a new 300. So that's our challenge. So as fast as we are clearing samples, we are already taking in new samples. So it's not something that we clear off and then we'll accept again, right? So it's an ongoing process because every day people are coming who have been exposed, who have symptoms, they're coming to us and we have to test them. Now, one of the things, because we recognize that the, the people who are coming forward to get tested, they perhaps are at different stages of the disease. And some of them just want to know whether or not they have been exposed and so forth. So we have prioritized the way that we have been testing. So a person who has been in hospital and they're critically ill would get first priority. Health workers who have been exposed get first priority. So we have categorized the way that we are processing samples, and I want the public to understand that as well. So an asymptomatic person who thought they might have been exposed show up, got a sample done or got a swab done, and that sample is sent for processing. It is not the same as somebody who is critically ill and in the hospital, and we really need to know whether that person is positive or not. So the hospitalized person would be given priority in terms of processing so that we can know how to treat and what to do. And that is what has been happening so far. So I'm really sorry for the delay for some persons not getting their results in time, but this is what we've been doing, and I think when you have this type of scarcity, we have to prioritize, and that is what we've been doing so that our critical patients would be able to get the results in time.
One other thing, Minister, can you say by how many persons were trained to start testing when we do have the equipment?
We have 30 persons who have received training in the processing of these samples. So the actual collection or testing, doing the swab, is a relatively simple process. And almost every doctor can do that. Nurses and so forth can be appropriately trained to do that. So sample collection is not the issue really. That's the easiest part of the thing. The challenge has been when these samples get to the laboratory in terms of processing it. There are several stages that that sample would have to undergo, and each one of them would require certain technicalities. So we have trained about 30 persons, both from the private sector and the public sector, to be able to do this. So we have, I think, enough people right now What we now have to make sure is that we have more equipment so that they can work simultaneously. On another note, you would be pleased to learn that we have now moved into the Ocean View facility, and we are going to continue to put more patients there as time goes by. But the facility, we've started using it, and we intend to continue using it so as to decant patients from the Georgetown Hospital.